through COVID-19 infection. Dr. Raji.
Thank you to one and all. I am Dr. Rajiv Das. I am just third year junior resident fellow. So my topic is a simple work on analysis of communication framework for people choosing telemedicine. So telemedicine, it was like 100 years back. Hugo Jones' work after the Spanish flu. He gave the term pterodactyl, but we forgot the actual the methods and what he told. In the photo over here, we can see a person is looking from the computer, and the patient is getting treated. So now, we go to the history. The idea of telemedicine was from the Hugo Jones' in 1935, and he predicted that the device would allow the doctor to examine the patient from distance. So a doctor diagnosis, the photograph was published in the magazine, and in India in 2001, ISRO, the Indian Space Research Organization, connected Apollo Hospital in Chennai to a rural hospital in Andhra Pradesh, and from there it started all over India. Indian government issued a practice guidelines for teleconsultation, telemedicine for all allopathic doctors on 25th March of 2020, just after 1 or 2 days after the lockdown. So, introduction, telemedicine is the natural evolution of healthcare to the digital world. We all are going e-medicine. So, telemedicine translates like healing at a distance. WHO defined telemedicine as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for containing education of healthcare providers, all in interest of advancing the health of individuals and their communities. It's a large definition. So, I've shared a photograph of Arogyasri, in which a patient-centered approach of telemedicine is shown over there. The patient will be given, the data will be there, and it will be stored in a place, and then the doctors will see and comment on it. It is a large population. We are still lacking behind, like the number of patient and doctor ratio. So I believe we should go a bit further on this telemedicine. Now, we have seen, we have talked about Chennai Apollo Hospital and ISRO mission. So nowadays, in some places, notable places like Sri Gangaram Hospital, Oncology Department in the Regional Cancer Center, Trivandrum, tele-ICUs in private hospitals. I'm from RIMS Ranchi. In Ranchi, we talked about one of the hospitals is actually using this tele-ICU, and it's from the Bangalore. So my methods was very basic. It was Google Forms, and Google Forms were circulated among the patients. And after the ICU approval, in the Google Maps, in the Google Forms, there was in the first 2 slides only, and they will be asking that whether you want to participate. So the consent was taken in the Google Form only, and then they were also educated about telemedicine and what we can do about COVID vaccines, whether they have taken or not. The Google Form questionnaire, so it is a questionnaire method, it's a snapshot study, it's a cross-sectional study, and the questionnaires were circulated among the patients, and they have recovered from the COVID disease. One of the doctors was me, because I was treating also in online. So I requested my patients, and I told them whether you can, you're lacking this way of getting treated. So out of 200 individuals, there were many individuals, many of them were like, I don't want to take part. So 200 individuals took part, and 194 responded at that. So majority of the individual responded, communicating with the doctor was not difficult. So it was a percentage based study, because yes and no were there in the questions. There are 20 questions, and 70% individual felt that it is better way of getting treatment during pandemic times, and 76% would recommend this to others as well. 77.8% were not asked about fees. So many NGOs were also working. 88.7% people said it is easy to connect to the doctor, because there were many my IT friends who were not able to where they're at home, they were treating their families were getting infected with COVID. 87.1% of the people were like they understood that they can get to with the doctor. So the patient-doctor communication was very good. And 91.2% said that the pharmacist understood the drugs given by the doctor, and 86.1% individuals were not required to go to hospital after the online consultation. Majority, in 80.9%, were asked about their body weight, drug allergy, and previous medications and the medication history. Overall, the patients were satisfied. So, teleconsultation, as we know, it helped. It was an effective means to acquire healthcare facilities during this pandemic era. The process was smooth and there were no communication hurdles for majority of the people. Overall, the sense of satisfaction of majority of individuals were very good, and the telemedicine was maintaining the physical distancing which was relevant in the pandemic times. It ensures timely follow-up, allows the proper utilization of the scant medical resources, and makes healthcare accessible, affordable, and efficient. These were my references, and in my thank you slide, I just want to say these were the Google form. The right hand side you can see the 195 responses. The first one was wine, so I just want to test whether it's working. It's easy for the patients or not. This is how I got my data, and then I made the user Excel sheet and I prepared the percentage one. Thank you.
Thank you, Dr. Rajiv, for this contemporary topic of telemedicine that you picked up in the COVID times. I would want to clarify something before I pass it on to the judges. You said in the talk that you were one of the doctors, who were giving the teleconsultation. There were other doctors also.
Yes,
you knew about the other doctors who were giving, and therefore you were knowing this is the patient pool of those doctors.
Yes, sir.
So I don't know how you were able to undo the level of bias when you were asking your patients. Generally, patients on face of the doctor also have to say that you are very good doctor. They can't say you are bad. Even if you might say that the Google forms will be anonymous, not everybody is so tech savvy to know that anonymity will be maintained directly. The forms are going to you. So that question definitely crept in my mind. So yeah, bias. आपको तो अच्छा बोलेगी, है ना?
I'm just satisfied. At the end of the day, they were like, that's right. Yes, ma'am. Yes, ma'am. Yes, sir. We were.
Dr. Shalini has asked my question. Just joking. Rajiv,
Yes, ma'am.
slide numbers are missing.
Yes, ma'am.
Okay. I did not see a slide on the study objectives. There was no slide only on the objectives. Okay. Third thing, your demographics were completely missing. You took some 200
Yes, 200 patients.
Male, female. What is wrong with all the presenters? I'm not seeing any demographics. How do I know? Then you talked about a 20-point questionnaire. I was looking forward to your presentation. You didn't talk about validation of the questionnaire. Who's validated it? Did you have content validity, construct validity? Yeah. And again, for example, in the demographics, did you even look at socio-economic strata? You're treating a lot of patients, right, from very poor to very rich. How many of them would be savvy enough, what Dr. Shalini asked, to fill the Google form?
Yes, ma'am.
So if you didn't have representation from another socio-economic strata, then that sort of creates selection bias, obviously. Yeah, so very good study, in terms of telemedicine. But I wish you all would pay attention to detail. That's all I can say.
Definitely. Even my patient where I couldn't generate the form in Hindi, and most of the people who don't understand English, I was not able to tell them. I talked to two patients
that happens, when you can't talk to them, what Shalini is saying is the same thing. आप अगर बात करोगे, then there is a certain sense of intimidation. You're not sure how your results will be used. Name gets associated there. Anyway, I've said what I've had to say. Thank you.
Thank you.
Plug these gaps when you do the next study. This is for everybody actually. A lot of good studies which is